While sitting in my clinic, I saw a person entering with a pain in the legs which is swollen. And I told him that don't worry, these pains and swellings are very common. You will get a normal cure. I am Dr. SK Sahoo, practicing at Apollo Hospital 26 Noida. My job to give you the clarity about your leg pains. Please understand, the swelling of the legs are maybe both sides or both the legs, which is called symmetrical, or it may be localized to one leg, which is called asymmetrical. So any swelling is also called edema. When it is localized, this is all due to local causes. The location decides the cause and the cause decides the treatment. The common causes of local pain, local swelling are bruises, trauma, or some fractures. These are the common day-to-day event practices. Similarly, in common day-to-day practices, you will get local swellings like carbuncles, boils, and other infective focuses of the bone which is beneath inside, which is not always visible. Other common causes of your localized swelling are because of the veins, and varicose veins are very common. Arteriovenous malformations of the lower limbs are also very common. When there is a problem of one thing, then it gives rise to the other thing also in tandem. So we have to look the other limb also whether it is there or not there. So if the other limb is also there involved, it is called symmetrical. If both limbs are involved, this is called symmetrical swelling. The symmetrical swelling is only possible whenever there is a problem of your fluid or circulation related to heart and the nutrition also. In bilateral swelling, which is called symmetrical, it is very common in acute nephritis, nephrotic syndrome, congestive cardiac failure, anemia, hyperproteinemia, long-term starvation, and you get a lot of other things in which you get a bilateral swelling. The common bilateral swellings are usually in circulatory nature. Other common bilateral swellings you get in chronic malnutrition. Also you get a chronic bilateral swelling in diseases of liver, which is called cirrhosis of liver or alcoholic cirrhosis with decompensation. You get swellings also in the lower limbs in portal hypertension. These are related to the liver systems. So many of the cases are medically managed. This medically managed can be done in a very simple clinic where a general practitioner or a doctor can detect you the things what are the causes. Location decides the causes and the causes also decides the treatment. So if it is a local one, if it is a boil, if it is a carbuncle, please do a simple test like CBC, complete blood count, the level of the TLC or the level of the counts of platelets and the level of counts of the leukocytes. That will decide whether this infective focus is there or not there. Suppose there is a pus formation or carbuncle is there, you can do a gram staining of the lesion from the lesion, and you can decide the things. And if it is a generalized bilateral swelling, simple tests will also tell you what are the things that can be done. The simple tests that you do on a daily basis are kidney function tests, and you do for elepty tests and also do the urine test. If there is some minor problems in urine, like proteins in the urine, then there is some sort of kidney problem that happens to either you are having acute nephritis or chronic nephritis or nephrotic syndrome. Similarly, if you get elepty and little changes in your enzymes, that means the liver is at stress, the liver is at injury, and you get some ideas about that. The other common conditions than physical examination in a bilateral swelling of the legs, you should go for pulse rate, you should go for blood pressure. If the pulse rate is high, the blood pressure is high, and the neck's veins are also engorged, that means there is some sort of congestion and some sort of strains to the circulatory system. And BP is a simple test in which you can know there is blood pressure. If there is high blood pressure and there is swelling, that means the heart is failing. If the heart is failing, you should give attention to the examination of the heart. And after blood pressure, you can go for other tests of heart, that is called electrocardiogram, That will also decide the condition of the heart, whether it is thin or it is thick, or it is just normal or about to be thickened. So that gives the stages of the heart. So these are the conditions of bilateral swelling. Sometimes bilateral swelling happens in long-term diseases of starvation, anemia, hyperproteinemia. In condition of anemia, hyperproteinemia, you go for the test of CBC. If the hemoglobin is low, that clinches the diagnosis. Once there is anemia, the causes of anemia has to be sought. So these are the causes of these bilateral lower limb swellings. Unilateral swellings, which is asymmetrical, is always locally stable, locally limited, and does not spread and does not cause much problems if it is attended honestly, clearly, and quickly. But bilateral symmetric edema of the foot, it needs attention of multidisciplinary approach, because it involves multiple organs. It involves the organ of the liver, it involves the organ of the heart, it involves the organ of the kidney. These are the three main organs which are at fault in giving bilateral lower limb swellings. Sometimes you get bilateral lower limb swellings in inferior vena cava obstruction. So you get that sort of things. Also, you may get bilateral thrombophlebitis, where you get bilateral swelling of the legs. Thrombophlebitis may also present as unilateral swelling, where you can get little bit of swelling in one leg and is not swelling in the other leg. So that person also you have to see. Deep vein thrombosis, you get unilateral swelling or asymmetrical swelling. It may be bilateral if the obstruction is higher up. If it is always unilateral if the obstruction is lower down below the femoral vein or lower down the femoral artery. So this is about the leg swellings.